Cesia Gallegos. I'm one of the cardiologists at the Heart and Vascular Center at the Yale New Haven Hospital and Norwich sites. It is my pleasure today to be participating in this talk about nutrition and its impact on high blood pressure and cardiovascular health. I will be joined by one of my colleagues, Dr. David Narotsky, as well. So it's important to talk about this topic, and I hope you find it useful as well. Yeah, as you may know, heart disease is the leading cause of death for men, women of most racial and ethnic groups in the United States. According to data from the CDC, one person dies every 36 seconds in the United States from cardiovascular disease. So one of the most important strategies to prevent and manage heart problems are a healthy diet and lifestyle. And it's not as hard as you may think. When we talk about nutrition, it's important to remember that's really the overall pattern of our choices that really count. And so making some simple changes and taking some simple steps that I will talk about and making that into a part of your life will really provide long-term benefits to your health and your heart. We talked that foods with good contents of potassium or polyunsaturated fatty acids and protein, along with exercise, may help to improve your overall health. So now we've talked about why it's important to have a good nutrition. Now, practically speaking, what we call healthy eating can become either difficult because we're not used to, or we don't know what the best foods are, or it can also become financially difficult. But there are actually ways to eat healthy when we have a short amount of time and also when we're on a budget. So I'm going to give you some tips. So I know from personal experience that sometimes we just want to have a quick make a quick dinner, and we have canned foods or frozen foods, and we're often wonders like, are canned foods or frozen meals, are we always bad for my heart or for my health? And the answer is no. And there are certain things that we need to be aware. For example, if we're buying canned foods, and these are black beans, look for the low sodium label, such as this one. Other things that you can do is that once you open the can, if you rinse it with water, you're going to be removing most of the sodium. So these are two excellent options. So for example, chickpeas and beans are two excellent options for plant-based protein. And then you can get creative, like, use spices like black pepper or garlic, onion, chili flakes or something like that to make a tasty meal. So, as a summary, a healthy diet should have, a wide variety of fruits and vegetables that we can also find canned and frozen. A lot of whole grains, healthy sources of protein like legumes or nuts, fish, seafood, non-dairy, non-fat dairy. And if you eat meat and poultry, just make sure that they're lean and unprocessed. Things that we should avoid is all those processed foods, any added sugars, and food prepared with extra salt like chips or excessive alcohol intake, because all of these can cause a spike in blood pressure and make your blood pressure more difficult to manage. And I will now allow my colleague, Dr. Narotsky, to continue to talk to you about blood pressure.
Great, thank you so much. Well, so if we're going to talk a little bit about blood pressure, I want to share some of the things that I think that you need to know about it, and then maybe go through a few tips and tricks, borrowing a little bit from the nutrition aspect and other tricks that you can use to help lower your blood pressure using more lifestyle methods rather than medications. So high blood pressure, actually something that people don't really realize is that normal blood pressure is usually less than 120 over 80. That's normal to be less than that. Many of our patients and many of us run in the blood pressures of 130s over 80s, and that's actually considered stage 1 of hypertension or high blood pressure. So we're really trying to get below the level that we've gotten comfortable with, which is the 130s over 80s. We're trying to get lower than that, ideally. Now, what do people worry about with blood pressure? People really worry about something suddenly happening a lot of the time. So, what we call hypertensive crisis, when the blood pressure is just way too high and not a natural variation, is usually blood pressure is over 180 over 120. And that's what we call a crisis because at that level, you can actually cause some injury to the heart, or you can even cause some injury that could lead to a stroke. So a lot of the patients call me and get really worried, but unless we're at those levels, usually what we're worried about is the long-term effects of the blood pressure. We're talking about years and decades, and that's what we're trying to prevent. It's the years and the decades, but we do obviously have to prevent any of the sudden changes that can be immediately dangerous. So what are the long-term effects of high blood pressure? So a couple of things that I mentioned, stroke and heart attack are definitely, related to high blood pressure over the years, but your other organs can feel it as well. The kidneys, especially, can be damaged with long-term high blood pressure. And then something that we don't really talk too much about is the kind of congestive heart failure that results from when the heart muscle gets stiffer over time, called diastolic heart failure. And that's usually a consequence of either diabetes or long-term high blood pressure as well. So it's not necessarily the heart failure that you think of immediately, it's more the long-term effects of the high blood pressure that are playing the role there. So how do we really measure blood pressure? So I think these are the tips and tricks that you need to know. When you measure your blood pressure at home, measure it calm and relaxed. We want to know your resting blood pressure, not your blood pressure when you're panicking about something, when you've just exercised. You want to sit down. You want to keep your arms about the level of your heart. Your legs should not be crossed. Your cell phone should not be vibrating at that time. Ideally, the kids should not be crying. And what I want you to do is take it at different times of day and keep a recording, keep a log, so that you can control your own fate a little bit and keep mastery of your own blood pressure. Check your blood pressure, and if it's high the first time, take a breather, meditate. 30 seconds later, check it again. And one thing we do recommend for accuracy, we prefer cuffs that go around the arm rather than around the forearm, just because we tend to be a little bit more accurate. So what are some of the things that you can do? Dr. Gallegos was mentioning some of the wonderful nutrition aspects. There's a couple of diets that have been proven scientifically to be effective. The DASH diet, which is the dietary approach to stop hypertension. And the goal of that diet is really to promote low sodium or low salt diets and diets that are high in foods that have high potassium. So what are some of those foods? Some grains, leafy vegetables, beans, lentils, fruits, some dairy. And it does talk in moderation about meats and other things that you can have. The other major diet that was popularized a few years ago is the Mediterranean diet, which again is borrowing some of the things we talked about before, which is about healthy oils such as olive oil, and also trying to avoid processed foods, which is a big part of that diet as well. So what are the ways to cut down sodium? Sodium or salt is the biggest offender in causing high blood pressure in our day-to-day nutrition routines. Some of the options that we can use sodium-free spices. Try not to add excess salt when you're cooking rice or pastas. When you're choosing vegetables, choose ones that are plain, either fresh or frozen, but not ones that have sauces or spices added to them. You can choose similarly with poultry or meat, choose fresh or frozen without any added sauces or spices. And read the food labels, and you can consider low salt, low sodium options as well. That's part of the nutrition aspect, but that's one of the many arms that we can use to tackle high blood pressure. So a few different lifestyle things that you can do right now to change your blood pressure and lower it. So we talked about number one, which is eating right. Low salt, natural foods, not processed. Use other kinds of spices rather than pre-made rubs and sauces that you can buy at the store. That's the nutrition aspect. Number two, exercise. Losing weight, especially that belly weight, the adipose tissue, the obesity there, can really lower your blood pressure. It's the hardest to lose, but I think the best recommendation for the average person is try to lose 5 to 10 pounds and your blood pressure will get lowered and you might be able to come off that blood pressure medication. Sleeping. Good sleep is really important to your blood pressure. Many of our patients have undiagnosed sleep apnea. If someone you know is telling you that you're snoring pretty loudly, or you're really struggling at night and it looks like you're gasping for breath, or if you feel tired during the day, Be considered for a sleep study and see if you have sleep apnea, and maybe that's what's causing some of your high blood pressure. One of the big things, especially in today's society, and especially now in the pandemic, is stress. It's been proven that if you reduce stress using meditation, yoga, other techniques, go for a run, clear your head, that can really reduce your blood pressure. And the biggest one that we see a lot of, unfortunately, try to cut down on some of the addictive behaviors, such as cutting down on alcohol use and smoking, because both of those can damage your arteries, which eventually leads to higher blood pressure in the arteries, and then, a chronic state of hypertension or high blood pressure. So those are some of the other lifestyle techniques that you can use besides just good nutrition to help lower your blood pressure. I want to thank Dr. Gallegos for joining me in talking about nutrition and blood pressure today, and I hope everyone stays healthy.
Thank you so much. It was a pleasure. I will take you up on that tip for more sleep.
Good luck.